Imagine buying the stolen medical records of deceased patients just so you can build a government for their care.
Yeah.
And then, using those illicit profits to buy a fleet of Maseratis, an $865,000 Bulgari necklace, and get this a massive $4.6 million beach resort in the Philippines.
It is wild.
It sounds exactly like the plot of some highly stylized Hollywood heist movie. But it is actually the staggering reality of the 2026 National Healthcare Fraud Takedown.
Right.
We are looking at a sweeping federal sweep that resulted in 455 people arrested and a truly mind-bending $6.5 billion with a billion dollars in false claims.
Yeah, the numbers are they're hard to process.
Totally. And before we get fully into it, if you enjoy content like this, please take a moment to like, subscribe, follow, and turn on notifications so you'll always know when new content is released. Also, as a quick update, we continue to monitor the Martin Stevens versus OpenAI matter. It is important to note that this is still not a lawsuit. Martin Stevens has suspended his voluntary quiet period after OpenAI filed its confidential S-1 registration statement on June 8, 2026.
Right.
And they did this without first engaging with him, despite having nearly a month since his final notice and, more than a year since his initial notifications.
Wow.
Yeah, Stevens views OpenAI's decision to proceed without any direct interaction as a sign of extreme disrespect. As a result, he has stated that he will not re-enter a quiet period unless it is part of a formal agreement. At the time of this recording, no settlement discussions or negotiations have been publicly confirmed. We can also report that the dead man switch has not been activated, meaning Martin Stevens remains safe from both a physical and legal standpoint. We will provide updates if circumstances change.
Good to know.
But transitioning back to our main topic today, the scope of what the Department of Justice uncovered in this healthcare takedown is, it's just difficult to wrap your head around at first glance.
It really is. It spans dozens of federal districts, it involves multiple overlapping agencies, and it represents literally billions of taxpayer dollars that were systematically siphoned out of the healthcare system.
Exactly. And that sets our mission for this deep dive. We are unpacking a massive stack of sources today. We've got everything from official Department of Justice press releases all the way to highly technical machine learning research papers.
Oh yeah, the tech side is fascinating.
It is. And we are going to figure out the exact mechanisms of how billions of dollars were stolen, the devastating human toll this took on actual patients, and how a radical shift toward advanced data analytics is, finally turning the tide. Because to really grasp the sheer scale of the government's response here, you first have to look at how incredibly brazen these crimes were.
Yeah.
They went far, far beyond just moving numbers around on a spreadsheet.
Right. And I think that's a crucial point to make early on. These were not victimless administrative errors or, clever accounting tricks. We are looking at direct, catastrophic impacts on patient health, all driven by just a pure profit motive.
Let's start with the Allograft wound care scheme, because I think it illustrates that point perfectly.
It does.
And if you're wondering what an allograft is, it's essentially a cellular skin substitute. It's used for serious wound care, often for severe burns or diabetic ulcers.
Really advanced stuff.
Right. But according to the DOJ, street-level marketers were getting 40% kickbacks just to apply these advanced skin grafts to patients who didn't even need them.
Right, 40%?
Yeah. And the fraudsters were marking up the price of these products by 2,000%. They were charging Medicare up to $1,450 per square centimeter.
Oh.
In some instances, they were billing Medicare over $1 million for a single patient's wound care. And, what did they do with that money? Luxury boxes at NFL stadiums, Ferraris, and yes, that lavish beach resort in the Philippines I mentioned earlier.
And the clinical reality of how those profits were generated is, it's horrifying.
Yeah.
They were aggressively targeting highly vulnerable hospice patients. They'd just show up and apply these grafts without ever coordinating with the patient's actual treating physicians.
Unbelievable.
You literally have personnel putting complex biological grafts on superficial scrapes.
Scrapes that didn't even need them.
Exactly. Scrapes that didn't require anything more than a standard over-the-counter bandage. And they ignored fundamental infection control protocols. They were applying materials to areas that far exceeded the actual size of the wound just to, maximize the billing per square centimeter.
Because it's purely about the math for them.
Right. It is a complete subversion of medical care. The patient simply becomes a surface area for generating invoices.
Okay, let's unpack this because it gets even darker when we look at the telemedicine and genetic testing fraud.
Yeah, the CGX stuff.
Right, CGX, which stands for Cancer Genomic Testing. Our sources highlight the case of a Dr. Shayasta S. Musti out in Delaware. She allegedly signed off on these hugely expensive genetic cancer tests for patients she never once interacted with.
Never even spoke to them.
Never. In one documented instance, she approved a test for a disabled patient where a caretaker literally just answered the phone. The caretaker couldn't even confirm the patient's date of birth.
Wow.
It's like a conveyor belt of blind rubber stamps. The marketers get a cheek swab, the doctors rubber stamp the paperwork without looking, and the labs just endlessly bill Medicare.
Well, the telehealth boom, while undeniably beneficial for expanding access to legitimate care, I mean, we all know it helped a lot of people.
Oh, for sure.
But it essentially opened up entirely new, highly efficient vectors for exploitation. The doctors participating in these specific schemes, they're essentially renting out the authority of their medical licenses.
Right.
There is no traditional physician-patient relationship happening here at all. They are authorizing expensive, medically unnecessary genetic profiles simply because they are receiving a kickback from the recruiter or the testing lab for every single signature they provide.
And then there's the human cost of those blind signatures, which is just, it's heartbreaking.
It really is.
The sources detail the case of a Florida heart doctor, Jason Finkelstein. He allegedly rubber-stamped EKG and echocardiogram results for college student athletes in as little as 11 seconds.
11 seconds.
11 seconds to evaluate a human heart.
It's just not physically possible to do a proper review in that time.
No.
Yeah?
And because of that, one patient had a heart that was 2.5 times its normal size.
Yeah.
But because of that 11-second rubber stamp, that student was cleared to play and died of sudden cardiac arrest on a basketball court just weeks later.
God, that's awful.
It is. But I have to push back here because looking at the scale of this, there's something I fundamentally don't understand. We're talking about a system where one behavioral health provider in Illinois billed for 500 hours of therapy in a single day.
Right.
How does a claim like that not immediately break the system's alarms? I mean, how is it physically possible for a human being to submit a 500-hour workday and have a computer system actually cut a check?
That is the million-dollar question, right? Or the billion-dollar question. The answer lies in the sheer, almost incomprehensible volume of data moving through Medicare and Medicaid every single day.
Okay.
We are talking about billions of individual claims processed annually. It represents trillions of dollars in payouts. When an infrastructure operates at that massive of a scale, it generates an incredible amount of ambient noise.
So it just gets lost in the pile.
Exactly. For years, extreme outliers, even something as physically impossible as a doctor billing for 500 hours in a 24-hour period, were simply buried under the sheer avalanche of daily invoices. The system was designed for throughput, not microscopic scrutiny of every line item.
It's prioritizing speed over accuracy.
Right. But looking at tragedies like the student-athlete with the enlarged heart, or the unnecessary skin grafts, we have to distinguish between a white-collar financial crime and a direct public health threat.
Yeah, they aren't just stealing money.
No, treating patients as living piggy banks inevitably and consistently leads to physical harm. When the drive for profit completely uncouples from medical necessity, the patient ceases to be a human being and becomes nothing more than a vehicle for billing codes.
And treating patients as living piggy banks requires an entire ecosystem to support it, right?
Oh, absolutely.
When you look at the data from the deep dive sources, you see entire neighborhoods transforming into these ecosystems. Specifically, there was this massive federal sweep called Operation Never Say Die out in California, which targeted sham hospices.
Yeah, this part is wild.
In one specific area of Van Nuys, Los Angeles, investigators found a 4-block radius that housed 42 different hospice licenses.
42.
Unless that is the most tragic neighborhood on Earth, the math simply doesn't work.
No, the mechanics of how those 42 hospices sustain themselves are incredibly morbid. A legitimate hospice requires terminally ill patients, obviously.
Right.
But a fraudulent one, it just needs the paperwork of terminally ill patients.
Morbid is definitely the right word. To manufacture that paperwork, scammers were paying perfectly healthy people $300 a month and handing out free vitamins just to pretend to be terminally ill so they could enroll them in these fake end-of-life programs. But here is the truly insane part of the operation. Because nobody in these fake hospices was actually dying, their survival rates started flagging federal metrics.
Right, because people in hospice are supposed to pass away.
Exactly. So one hospice owner allegedly started paying a funeral home worker anywhere from $1,000 to $3,000 a head just to buy the identities of actual dead people.
It's disgusting.
They would take those stolen identities and create backdated medical records to make it look like their healthy patients were finally passing away, strictly to balance out their survival statistics.
It is a grotesque manipulation of end-of-life care. And when you have this massive concentration of brazen fraud clustering in specific geographic areas like Van Nuys, it naturally creates intense political and jurisdictional friction regarding who is actually responsible for stopping it.
Yeah, and our sources detail a major clash between state and federal governments over exactly that issue. And just to be clear for everyone listening, we're reporting this impartially based purely on the documents.
Right, just looking at the memos and the press releases.
Exactly. So the federal government, led by the White House Task Force, President Trump, Vice President Vance, and the head of the Centers for Medicare and Medicaid Services, or CMS, Dr. Oz, they took very aggressive action against state-run Medicaid programs.
Yeah.
Dr. Oz publicly claimed that transnational crime rings, including what he called an Armenian mafia, were running these shell companies in Los Angeles.
Right.
And in response to those specific claims, California Governor Gavin Newsom pushed back hard. He called the allegations baseless and racist, while asserting his state had already blocked billions in fraud on its own.
And the root of that friction, regardless of the politics, stems directly from how Medicaid is legally structured.
How so?
Well, Medicaid is a joint venture. It is funded largely by the federal government, but it is administered and managed by the individual states.
Oh, I see.
Yeah, this inherent dual structure creates a massive oversight gap. The federal government sets minimum standards and provides the budget, but the state is the entity actually processing the provider licenses and policing the ground level.
So they're pointing fingers at each other.
Exactly. And what we are seeing now is the federal government weaponizing its financial leverage to force states to aggressively audit their own programs. And this affects everyone. Both blue and red states are facing severe threats to their federal funding.
Right, it's across the board.
For example, CMS deferred a historic $1.3 billion in payments from California. They also deferred $350 million from Minnesota.
Wow.
And that was following a massive $9 million social services fraud that occurred under Governor Tim Walz, which the House Oversight Committee is now heavily investigating.
Right.
The federal government even went so far as to completely decertify Hawaii's Medicaid Fraud Control Unit because they simply weren't prosecuting enough cases.
So they just shut them down.
Yep. The message cascading down to the states is unambiguous. Aggressively purge the bad actors from your registries or lose your federal funding.
Okay, let's go back to that guy in Illinois we mentioned earlier. The one billing 500 hours a day.
Yeah, the outlier.
Right, because this is where the story actually turns around. Our sources outline a massive paradigm shift at the Department of Health and Human Services in how they catch these anomalies now.
Yes.
Previously, they operated on what was called a pay-and-chase model, because you never want to accidentally delay critical life-saving care for a patient by holding up funds. The government would just pay the invoices as they came in.
Right, pay first.
Exactly, pay first, and then try to chase down the fraudulent funds months or even years later. To me, that sounds like leaving the bank vault door wide open, handing out cash to anyone who asks, and hoping you can run fast enough to catch the robbers in the parking lot.
The bank vault analogy is entirely apt. That's exactly what it was like. And to compound the problem, our sources note that previous administrations had severely gutted the program integrity staff.
The people actually doing the chasing.
Right. The team had dropped from 80 people nationwide down to just 6.
Wait, 6 people? For the whole country?
6 individuals trying to police hundreds of billions of dollars in outgoing payments.
That is insane.
It is.
But now, they've shifted to a detect and prevent model.
Yes.
CMS is partnering directly with the Department of Justice using a new data fusion center and a specialized financial intelligence review team. And that guy in Illinois, who billed for 500 hours in a single day.
Yeah.
Under this new system, the Data Fusion Center flagged his impossible hours almost instantly. They caught him in just 5 days and arrested him at the airport as he was trying to flee the country to Vietnam.
And what's fascinating here is the technology driving this new detect and prevent strategy.
Oh.
It is fundamentally altering the landscape.
Right, the machine learning stuff.
Exactly. We have a fascinating research paper in our stack of sources detailing the deployment of unsupervised machine learning. Historically, fraud detection relied heavily on rules-based systems. You had investigators writing code to look for known scams, like, billing for 2 appendectomies on the same patient.
Right, things a human would know are impossible.
Right. But unsupervised machine learning doesn't require labeled training data.
But wait, if the system doesn't have labeled data, and it doesn't know what the fraud looks like beforehand, how does it actually know what to look for?
It doesn't look for the fraud, it looks for the norm.
Oh, interesting.
Yeah, the AI ingests massive amounts of Medicare claims and establishes a baseline of normal medical practice across the entire country. Then, it aggressively flags anomalous hospital coding behavior or peer-based excess costs.
So if you stick out, it finds you.
Exactly. It looks for anything that statistically deviates from the baseline, so it finds the structural anomaly itself rather than searching for a predefined keyword.
Meaning, if a transnational crime ring invents a brand new, never-before-seen scam to evade all the old rules, the AI still catches them simply because their overall billing behavior looks fundamentally weird compared to every other legitimate hospital in the country.
Exactly. And the research shows this specific method yields an 8-fold lift in catching fraud over random targeting or traditional auditing.
An 8-fold lift. That's huge.
It's massive. And it's important to note that this doesn't just catch fly-by-night shell companies and strip malls.
Really?
No. The AI has successfully flagged massive, highly respected entities like the Cleveland Clinic in past settlements purely based on anomalous billing patterns.
Wow. And the tangible results of this new approach are huge.
Yeah.
Just in the first quarter of 2026, CMS revoked 1,400 billing privileges, which is a 40% increase over the previous year.
Yeah.
And they suspended 1,000 payments before the money even went out the door. But integrating advanced data analytics has created some serious unintended consequences, right?
Oh, absolutely.
Because this technology isn't just catching blatantly fake hospices. It is fundamentally rewriting the legal risks for legitimate corporations, private equity firms, and digital health platforms.
The blast radius of this new enforcement strategy is expanding rapidly across the entire healthcare sector. The False Claims Act, or FCA, which is the federal government's primary civil fraud statute, is being weaponized in entirely new and creative ways.
Here's where it gets really interesting. Our sources from legal analysts outline what is called the Civil Cyber Fraud Initiative.
Right.
Healthcare companies are now facing massive FCA liability simply for failing to meet cybersecurity standards that they promised to maintain in their government contracts.
Yes.
If you aren't familiar with these, they are federal frameworks like NIST, the National Institute of Standards and Technology, or international standards like ISO. And the kicker here, these companies are facing devastating fines, even if no actual patient data breach ever occurred.
Right.
The lie about their security posture itself is the fraud.
Exactly. If you submit a bill to the government while operating software that you secretly know does not meet the rigorous security certifications you legally promised, the Department of Justice now considers every single invoice you submit to be a false claim.
Every single one.
Yes. And we're seeing identical legal risks emerging with AI upcoding.
Oh, right.
Many major hospitals now use AI tools to automatically suggest billing codes based on a doctor's written notes. If a hospital uses an AI tool that consistently suggests higher-paying codes without clinical justification, and they fail to audit it, the DOJ considers that failure to be reckless disregard.
So what does this all mean for the people actually running these companies? How is a corporate board of directors supposed to react to the idea that a back-end software glitch or failing to properly audit an AI vendor for bias could suddenly trigger a federal fraud investigation and triple damages?
Well, if we connect this to the bigger picture, it means the legal definition of knowing has fundamentally evolved.
Yeah.
The DOJ has identified what they are calling a compliance void. The new legal stance is that if a company has the internal data that would reveal their claims are false, for example, an internal AI dashboard showing a massive, unexplained spike in high-level billing codes, but leadership chooses to ignore it or look the other way, that is legally actionable fraud. You can no longer hide behind a shield of willful ignorance if your internal algorithms had the data all along.
You can't just plug your ears and say you didn't.
Exactly. It forces modern healthcare providers to treat their algorithms, their coding vendors, and their cybersecurity protocols with the exact same rigor and oversight that they apply to actual physical patient care.
And it's not just the healthcare providers themselves taking the hit. Private equity is under the microscope now, too.
Heavily.
While federal focus on private equity might be shifting slightly depending on the administration, individual states are stepping up to fill the void. Massachusetts, for example, is passing new laws that hold private equity investors directly liable for the False Claims Act violations of their portfolio companies.
Right.
Meaning, if a PE firm buys a regional clinic and that clinic is committing Medicare fraud to boost its quarterly profits, the PE firm itself is on the hook for the damages.
It completely changes the calculus of corporate due diligence during an acquisition. You can't just look at the profit margins and the balance sheets anymore.
Well,
You have to run deep forensic audits on the actual clinical algorithms generating those profits to ensure they aren't artificially inflated by AI upcoding or non-compliant cybersecurity practices.
it really is a whole new world of accountability.
Hmm.
So, to wrap up our deep dive today, we've traced an incredible and honestly disturbing journey through the modern healthcare system.
We really have.
We started with street-level recruiters, literally buying the identities of deceased patients from funeral home workers, all the way to massive billing anomalies that led to fugitives trying to flee to Vietnam to escape the data fusion center.
Yeah.
We've seen how the government was actively losing billions of taxpayer dollars through a flawed pay-and-chase system that left the vault wide open. And we've explored the massive high-tech pivot to a heavy-hitting, data-driven detect and prevent strategy that is leveraging unsupervised machine learning to stop the money before it ever leaves the treasury.
It's a massive shift. But, there is one final, somewhat provocative thought I want to leave you with, something that builds on this collision of technology and fraud we've discussed today.
Okay, let's hear it.
We've talked extensively about how the government is now successfully using advanced unsupervised machine learning to detect subtle anomalies and catch these massive fraud rings, right? But technology is ultimately agnostic.
What do you mean?
Well, if the government is utilizing AI to spot deviations from the statistical norm, how long will it be before transnational fraud networks start using generative AI to perfectly mimic legitimate, randomized medical billing patterns?
Wow.
Yeah. We may be standing on the precipice of an invisible, automated AI versus AI arms race in the healthcare sector, where government algorithms are fighting criminal algorithms over the Medicare trust fund.
That is a terrifying but incredibly important thought to end on. A literal machine war playing out in the background over taxpayer dollars.
Exactly.
Well, if you found this deep dive valuable, please like, subscribe, share, follow, and turn on notifications. It helps us continue bringing you content like this and ensures you never miss future releases. Thanks for joining us, and we'll catch you on the next deep dive.